We are here with the co-host of the show, Miss Kahe Richardson, and today it's all about how to do. So we're in the X-ray portion of the office, and Kahe will illustrate on the first. She will touch bases on the importance of the full mouth X-ray series, which is called the FMX for for people who's in the not too up on the terminology of the dental field. So Kahe, could you explain to the people why the full mouth X-ray series of X-rays are so important when initial consultation is performed by Dr. Eriks?
Well, for a couple different reasons. Dr. Eriks will do a evaluation of your teeth where he'll touch it with different types of explorers and instruments to be able to touch and feel for decay or abnormalities and things like that. But what an FMX does is it looks at places that we can't necessarily get to or touch with hand instruments. And that's going to be something like in between your spaces between your teeth. They're called your interproximals. And what this does is it's like the areas where you floss. So sometimes if you're not flossing all the time, food can get stuck in there, decay starts, and once it starts, it doesn't stop. So it just keeps going deeper and deeper in the tooth. And so we'll take X-rays that can see in your interproximal areas, and it sees the spaces, and it'll have a discoloration if there's any type of decay or anything going on in there. FMX is also take a picture of your apexes, your roots. So basically the part of the tooth that you can see is your crown, and the X-ray is taking a picture of your crown and your interproximals, but there's an X-ray that takes a picture of your apexes and your roots. And what this does is you can see the health of your tooth under the gums and into the bone. And you can see if your veins, if your like your vessels, like the main line that comes into your tooth that keeps it hydrated, keeps it healthy and flushed, if you've got any bacteria, if you have an abscess, what it looks like in there, or if it's a healthy site and you have no difficulties. It also, X-rays helps us show fracture lines, breaks, things like that. Maybe you need a root canal or whatnot. So it just shows us a lot of things that we can't necessarily touch or feel. So.
Okay. So go ahead, let the people know the types of instruments that are used to conduct the full mouth series.
Well, these are called RINs, and if you haven't seen these before, basically what it does is it gives you something to bite onto. This little portion here is for whoever's taking the X-rays to line up the X-ray machine right in here, so it takes a picture of the film. This line makes sure that you can get, so you're going to have it flush this way, and you're also going to have it flush this way because you want an exact angle. It's very difficult once you put this in someone's mouth, once they bite on it, to make sure that it's placed in the right location so that you can see in between the spaces. Like if you do the front, that's kind of easy, it's a straight line. But you start getting in angles, and then back here, your upper teeth are angled differently than your lower posterior teeth, so you have to take that into consideration as well.
Okay.
There's 3 different types of X-rays. This is an anterior X-ray, so that's you do 5 up top and then 3 below. So this looks at your little tiny teeth. Then there's posteriors. Oops. Which these guys are going to take pictures of your posterior teeth, so your larger back teeth. So this X-ray is almost twice the size as the other one. And what happens is you put this in your mouth, you take a picture here, here, and then here, 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 here. So you take 8 of these.
Gotcha.
Then the last one, so these ones look at the roots of the posterior teeth and the crowns. Then this one sometimes gives you a better look at the interproximals. And so this one as well, you're going to oops. Sorry. So this one, when you put in your mouth, you bite on it, and so it'll get the picture of both upper and lower, but mostly just the crowns.
Gotcha, gotcha. So, how many X-rays are consistent in a full mouth series?
18 to 22. It depends on the doctor, it depends on the patient. Some doctors will make you take the full 22 just so that you can see the full mouth. Some say that you don't have to do it exactly like that. So if they're already missing their wisdoms and maybe, you know, if they had teeth extracted for braces or whatnot, then they'll let you do less x-rays.
Gotcha.
Just because you don't need to waste the films and use the extra exposures. So...
Okay.
And then these are little couple things. Sometimes we need to use a cotton ball to help align the x-ray. Like if somebody has a weird bite or can't hold something, this is used to make sure that the x-ray stays in place where we want it to so that we can get the full root view.
Gotcha.
These little things are like soft, squishy stuff. So, well, yeah.
Like little pads, little mouth pads?
They're little
pads.
soft, like comfortable squishies, and you put these on an x-ray. And it's so, sometimes people have sensitive mouths, and when you put these edges in there, they don't like it, and they say it hurts. And then they won't bite down, and they won't hold it for you, and then they start moving, and then your x-ray gets screwed.
Yep.
Usually the most hurtful spots in patients are the front posteriors. And that's just because their mouth gets a little bit smaller there. It's a little bit more sensitive. You're under your tongue right there where the frenectomy is. And up above where the roof of your mouth, sometimes it cuts there. So usually it's just the front unless they're real wusses and they need it on all of them.
Gotcha. And what is this flap jacket type of thing? What is...
Well, that jacket is to protect you from the x-rays.
No bullets?
No bullets.
Okay.
Yeah, not going to help you there. That'll go right through. The main part of this is, they say, you know, it's for covering the ovaries and for covering the thyroid glands and stuff like that. Basically, where you're shooting the ray mostly is just right through this small enclosure. So it's pretty isolated, but your thyroid is, you know, a large part that does get cancer quite easily, apparently.
Gotcha.
And so that's why you always have to make sure that the neck is on there really good and really tight.
Gotcha.
So nothing escapes down there.
Gotcha. And this is the body, the brains. This is what actually takes the x-ray?
Yes, this is what takes the x-ray.
Okay, so somebody will be sitting right there.
Mm-hmm.
Okay, okay. And where do you develop the x-rays once they're done?
We develop them in the x-ray room. The developer. So here's the developer. Right now you can see there's a red light because if you open up the x-rays and anything but the red light, then it'll expose them before we're able to process them. So it'll just come out solid. You won't see anything if it's exposed to light.
Okay. Well, anything else you want to add? I'm sorry.
I guess not.
Okay, well, there you have it, ladies and gentlemen. The lovely Miss Kahe Richardson just gave you a little 411 on full mouth x-rays, why they're important, and instruments that are used to take those. So, until next time, this is Flossin Daily with LA, Kahe Richardson, VerveSplash Media. We
Yay.
out. Thank you.